Treatment of atherosclerotic renovascular disease. Atheroesclerotic renovascular disease, or ARVD, is an impairment of renal perfusion caused by the disease affecting the arterial supply of the kidney. Causes are renal artery atheroma or arteriosclerosis, fibromuscular dysplasia of renal artery, prolonged hypotension or severe dehydration, embolic renal disease, renal artery or aortic dissection, and renal arteriovenous malformation. Risk factors include hypertension, advanced age, evidence of renal impairment, diabetes mellitus, family history of cardiovascular disease or renovascular disease, and hyperlipidemia.
Renal artery disease basically encompasses any problem that restricts flow to the kidney, and in almost all cases, that's a problem from hardening of the arteries or atherosclerosis. There are cases in young women where it's associated with other types of problems, but the majority of the issues we see are due to hardening of the arteries. But renal artery stenosis is a very common problem. It affects 7% roughly of all individuals over the age of 65. And it is thought to be a contributor to possibly as much as 15 to 20% of all new cases of people going on to dialysis. It's an increasingly recognized cause of severe secondary hypertension and chronic kidney disease. And at Wake Forest, we've had a long history in treatment of that problem with two of the world's foremost experts practicing here. And it's a huge part of the practices of two of the members of our group, one of those being me. We treat that from the absolute beginning to the absolute end. We have a lot of patients who we are managing medically and seeing them back frequently over time to make certain that they don't have problems that then require some sort of intervention. We also perform the full gamut of procedures for it, including stent-based therapies and open surgical therapies, and have one of the largest experiences in open surgical therapies in the world for that problem. It's also a very active area of research in our group, and we've participated in all of the major clinical trials for those, in addition to a number of NIH-funded, investigator-initiated efforts that were just here at Wake Forest.
Manifestations. Abrupt onset of hypertension in middle-aged or older patients. Severe hypertension. Hypertension resistant to standard medical therapy. Hypertension developed in the patients with non-peripheral vascular, cerebrovascular, and cardiovascular disease. Renovascular hypertension, and stroke. Treatments include medical management with drugs and a vascular risk profile optimization, vascular intervention techniques including angioplasty and stenting. Advice for renal artery stenosis. Optimize vascular risk profile through smoking cessation, diabetes control, statins, and adequate antihypertensive therapy. And avoid other potentially nephrotoxic medications.
Kidneys are supplied by renal arteries, and sometimes those renal arteries become narrowed by cholesterol plaque buildup or by another condition called fibromuscular dysplasia. The response the kidney has when it's not giving enough blood flow is it releases a powerful chemical in the body called renin, and that raises the blood pressure in the body. What we'll do in a situation like that, if the blood pressure is hard to control or if the kidneys are deteriorating in function because they're not getting enough blood flow, is we can go through the bloodstream with a catheter and perform what's called an angiogram, where we inject some x-ray dye into the kidney artery and confirm it's narrowed, and if it is, then we'll open up the artery either with an angioplasty balloon, or in the case of cholesterol plaque buildup, we'll typically leave a stent in place. A stent, of course, is a metal scaffolding. This is done under local anesthesia, sometimes with mild sedation, and we do this in the office operating rooms.
Thank you.